Joined now by Representative Chrissy Houlahan, a Democrat of Pennsylvania. Congresswoman, welcome to the program.
Good morning. Thanks for having me.
Can you update us on the latest on the government shutdown and what, if any, negotiations are happening among Democrats?
So have spent the last several weeks in DC, hoping that I will be met by the other side in conversation and negotiation to reopen the government. And unfortunately, that has not yet been the case. I'm really hopeful that we have the opportunity to kind of get down to brass tacks and make sure that we do the right thing for the American public, which means that they need to be able to afford their health care. To be honest, I'm one of the most bipartisan members of Congress year in and year out. And it's really frustrating to me that I haven't been met and we haven't been met at all in terms of any sort of negotiations. And we're now, I think, 15 days in.
What's the long-term strategy for Democrats?
I don't know that it's necessarily fair to call anything a strategy. It's just to do the right thing. This issue here is that this is not a clean CR, as people have said. This is a continuation of a very long and slow and painful shutdown that has started in the January timeframe and has been ongoing. I think that people are starting to understand. The American people are starting to understand what is at stake in terms of their cost of healthcare. But also, I heard another caller call in as well. That's the beginning of the problem. The problem is that people will shortly experience their healthcare premiums going up considerably. That people will shortly experience having Medicare and Medicaid unavailable to them. This will hit red and blue states and red and blue people. It doesn't discriminate. But also, this is just one of the indicators of how expensive it is to exist right now as an American. And so I think Democrats are not strategizing. This is just the truth. We need to make sure that we are taking care of the American people, regardless of who you are and where you live and what political affiliation you have.
You're the top Democrat on the Armed Services Subcommittee on Military Personnel. The troops were paid yesterday. Can you give us an update or an understanding on if National Guard, Reserve, civilian defense employees, contractors, any of those would be paid?
So you're right. I do serve on the Armed Services Committee and specifically on the Military Personnel Subcommittee. So I've spent a lot of time in Congress now, 7 years, focusing on the lives and livelihood of people who wear the uniform. I myself wore the uniform, as well as my dad and my grandfather and many of my family members. There couldn't be anything more important than honoring and valuing our American troops. It is my understanding that the administration has used what I have decried as a slush fund, 150 billion extra dollars that they put into the big beautiful bill that had no purpose. Well, the good news, I guess, if you can say it that way, is that a slush fund has allowed them to continue to pay our troops. My understanding is our troops are being paid. I don't believe or don't know yet whether the civilian sector and contractors, as an example, are being paid. But it's astounding to me, and this is an indicator of what's going on, that we can just find money. That is indeed not what's supposed to happen with our Constitution. The Congress is supposed to be the one that allocates and appropriates money for specific purposes. So we're responsible to the American taxpayer. And part of what I'm fighting against right now is the fact that we're eroding the power of the purse. We're eroding Article 1 of the Constitution, and Congress needs to do our job. And we need to make sure that we are the ones who decide what happens with the taxpayers' resources and money.
And there's a bill called the Pay Our Troops Act. You are not a co-sponsor of that, but that would ensure, we'll put it on the screen, military, defense department civilians, contractors, U.S. Coast Guard would receive their pay on a normal schedule. What's the status of that bill?
So, the very first thing that people have to kind of understand about the House of Representatives is that we don't get to choose what we vote on unless we are in the majority. And so, the majority right now is the Republican Party, led by Representative Mike Johnson. Mike Johnson decides whether we are there or not, literally in session or not. And he alone and the Rules Committee that is under him decide what we vote on. And so, until such time as we are called back to Washington, and until such time as he and the Rules Committee decide that we can vote on something like that, we cannot vote on that. And that's one of the things that's most frustrating. And you've seen that with the Epstein files. There's really only one exception to that rule. And that is if you sign a discharge petition and get 218 signatures to force a vote. But even then, that doesn't force a vote if we're not in session. And so I am enormously supportive of paying our troops. Clearly, that has been my history over and over again. In fact, I led a committee with Representative Don Bacon that gave junior enlisted more than 14% pay raise last Congress. So I couldn't be more enthusiastic about making sure we honor our men and women in uniform, but I don't get to decide what I vote on.
Chrissy Houlahan is on the program with us, and she will take your calls, so you can start to call in now. Republicans are on 202-748-8001, Democrats 202-748-8000, and Independents 202-748-8002. And there are roughly 15,000 of the VA's more than 460,000 employees have been furloughed during the shutdown. Can you give us an idea of how service at the VA might be affected by the shutdown?
And again, this began before the formal shutdown of 15 days ago. I have a VA in my community in Coatesville, and our VA, of course, services people from around the western suburbs of Pennsylvania. In the January timeframe, the government, led by this administration, began furloughs and layoffs of more than 30,000 people in the VA, and then, of course, they've continued now into this shutdown. It can't not affect service for our veterans, and of course, that's a real problem. In addition, many of the people who work at the VA are veterans themselves as well. And so this is again part of what I believe to be a pretty insidious undermining of the VA itself, with an intent, I believe, from the Republican Party to privatize it. So if you weaken and further suffocate the VA, then it's easy to say, look, it's not working for our veterans. And instead, rather, I think we should be supportive of the VA, and I think that we should be funding the VA, and I think we should particularly be focused on mental health issues, as well as the largest growing population of veterans, which are women and women's health issues as well.
You and fellow vet Representative Maggie Goodlander of New Hampshire are calling for Defense Secretary Hegseth to roll back his plans to dismantle the Pentagon Women's Advisory Group. Can you explain what that group was and why Secretary Hegseth would like to do away with it?
So this was a group, hopefully will continue to be a group into the future, that was started 75 years ago in recognition that a population, a growing population of people serving in uniform were women. This group was bipartisan, apartisan indeed, made recommendations that 90-something% of were adopted, and it's hard to find groups in Washington that actually work, but this was one. And many of those things that were adopted did not necessarily directly have to do with women in service, but rather had to do with the quality of life of people in service. As an example, paid leave, paid family leave was one of the things that they advocated for, and we were able to accomplish that a couple of Congresses ago. I really do believe that there's an effort to literally control F, to control find anytime that women or anybody else is mentioned in our armed services, and just eliminate that organization. And I think that that's at the peril of our readiness. I think that's at the peril of our lethality as a force. And I think that Maggie and I, Representative Goodlander and I, both having served, are really offended by the efforts of this Secretary of Defense, and it is still the Secretary of Defense, to undermine those who serve in the military who are women, which is more than 20% of the people in uniform now.